as the external features and general features of the thyroid we have come across, as it is a bilobed structure. Two lobes are there, right and left lobe, and isthmus, and this may be the pyramidal lobe, I have told. So now we are going to deal the next part of the thyroid gland is the relations. I have already told the general features in this. It is having the apex and base. Thyroid gland is having this is apex and this is a base, having the anterior border and posterior border. Okay. Then it is having the surfaces, three surfaces. One we have the medial, one we have lateral and posterior lateral. So this is the one which is you are going to get the lateral, lateral, medial and posterior lateral. These are the three surfaces, two borders of the each lobe which is we are going to get it, that is a lobe. Then I have told the borders, anterior border, posterior border. But isthmus is told, this is the isthmus. In this isthmus also is having the anterior surface, posterior surface, then upper border and lower border. So you are going to deal the surfaces, border relations as it is having the thyroid gland is having relating to the lobes and relating to the isthmus. So that you have to remember these all points, general features, then only you can understand this. Okay? So I have told apex, base, each lobe having the apex, base and anterior border, posterior border, two lobes, that is the two borders. Then we have the three surfaces, medial, lateral and posterior lateral. Okay? And isthmus is having the anterior surface, posterior surface, upper border, lower border. That is all we are going to deal the relations. When you take the section of the thyroid, when you take the section, transverse section at the thyroid level, thyroid gland. So we are going to have this way, all the structure relations you have to remember. Here this is a thyroid gland. This is the one transverse section of the thyroid. This is the one which is a thyroid gland. Then this is a relating, you can make this a medial surface and this is a lateral surface, and this area, this way is direction will be the posterior lateral surface. So medial side, lateral and posterior lateral. That is all are the lobes, that is the relations we are going to deal. Okay. So when you deal the relations of the thyroid, we are going to get we have the lateral surface. This lateral surface is related to we have the sternohyoid, sternothyroid, superior belly of omohyoid and anterior border of sternocleidomastoid muscle. So you are going to get laterally relations of each lobe of the thyroid is related to one is sternohyoid, this is sternohyoid, sternothyroid and superior belly of omohyoid and anterior border of the sternocleidomastoid muscle. Okay, so this is all about the one which is related to the one that is a surfaces relation, that is a lateral relations. Then medially, which is related to the two tubes, two nerves, two muscles. Medial surface of the thyroid, which is related to the two tubes. One which is we have the trachea and esophagus. Two nerve, we have the recurrent and external laryngeal nerve. Recurrent and external laryngeal nerve which are related. Then two muscle, cricothyroid, this is a larynx muscle. Then next which is we are going to get the inferior constrictor muscle. Those are the muscles of the pharynx. Means here medially the thyroid is related to the two tubes, two nerve, two muscle. Two muscle, cricothyroid, inferior constrictor muscles of the pharynx. Two tubes, trachea and esophagus, two nerve, recurrent and external recurrent laryngeal nerve. So those all related to the medial surface of the thyroid. So we have dealt the lateral, then we are dealing now is the medial surface of the thyroid gland. Going to the posterior laterally, we are going to get the carotid sheath. This is how we have come across carotid sheath in the content of the carotid triangle. So when we have dealt the carotid triangle, in that is the main content is the carotid sheath. So this carotid sheath contains the common carotid artery, internal jugular vein, and we have the vagus nerve. So these all will be related to the posterior lateral relations of the thyroid. Okay. Then we are going to also have the anterior border and posterior border of the thyroid. When we get the anterior border, which is relating to the, which you can see in the blood supply diagram, there you can mention the anterior border, which is related to the anastomosis between the anterior, that is the superior thyroid artery. Here we are going to get the branch superior thyroid artery, and we are going to get the inferior thyroid artery. So we are going to have the here anterior border relations of the thyroid is, there is an anastomosis between the anterior branch of the superior thyroid and inferior thyroid artery. So this anastomosis we are going to get, that is we are going to call the relations of the anterior border. So we are going to have this superior thyroid artery supplying the blood supply, that is giving the anterior branch that will relates to the anterior border. Then what would be the posterior relations of the thyroid? You are going to get posteriorly, you are going to get the posterior border of the thyroid is related to the, exactly we have the parathyroid gland. Most important, parathyroid gland and anastomosis between superior and inferior thyroid artery. This is anastomosis of the superior inferior thyroid artery. There is an anastomosis. Then we have the thoracic duct also on the left side, it is related. So these all will be the relation of the posterior border. Most important, you have to remember about the anastomosis between superior and inferior thyroid artery. Then we are going to have the parathyroid gland, that is, and thoracic duct, that is a posterior. Then anterior border, which is related to the, we are going to get the superior thyroid artery anterior branch. It is having dividing anterior and posterior branch. So that will be relating, anastomosis will be the relation of the anterior border of the thyroid gland. Okay. Then I have dealt the medial and lateral and posterior lateral surfaces. Then going to the isthmus relation. In this isthmus, you have to remember about this is having the upper border, lower border. Here the upper border is related to the, we are going to get the anastomosis between the right and left superior thyroid artery. Here we are going to get the anastomosis between the right and left superior thyroid artery, that will be relating to the superior border. Inferior border, where the inferior thyroid vein leaves the gland, and that will be related to the inferior border of the isthmus. So inferior thyroid vein leaves the gland, that will be the relation of the isthmus of the lower border, and the upper border, which is relates to the right and left superior thyroid artery branch anastomosis, that will be related. So exact position will be here. Then what would be the anterior relations of the, that is we have the isthmus. So we are going to have the isthmus is this area, connecting this area. Two lobes are connected here, isthmus. This will be the isthmus part. This is having the anterior and posterior relation. Anteriorly, it is related to the right and left sternohyoid and sternothyroid muscle. These sternohyoid and sternothyroid muscle, right and left, they are relating to the anterior surface of the isthmus. And posterior part, which is related to the isthmus, is the second and third tracheal ring. We are going to get the trachea is there, and exactly it is related to the second and third tracheal ring. So this is the relations of the isthmus, upper border, lower border, anterior surface and posterior surface. Okay. Then I have told the lobes, that is how we are going to have the medial surface, posterior lateral, then lateral, posterior lateral and lateral. Okay, three surfaces. Then one thing you have to remember, apex, where it is related? It is related to the middle of the thyroid cartilage. Relates at the middle of the thyroid cartilage, and base of the lobe is related to the, we have fourth or fifth tracheal ring. Here fourth or fifth tracheal rings are there. These are related to the inferior. Okay, fourth or fifth tracheal ring. Apex is at the, we get the thyroid cartilage at the middle of the thyroid cartilage, and the anterior border I have told anastomosis between the superior thyroid artery, anterior branch. Then posterior border is related to the parathyroid gland and anastomosis between the, that is the superior inferior thyroid artery. Then thoracic duct. Then I have already told you the relations of the surfaces. Okay, this is all briefly about the relations of the lobe and isthmus. Next, going to the, what is the histology of the gland, or the structure or histology of the gland. This is separately asked for the histology question. It may be kept for the slide identification, that is spotting. This is, you have to remember the, this is a section of the thyroid gland under microscope we see, and that is the histology of the thyroid gland. Very important, we are going to have the two types of cell. One cells which we get the parafollicular cell and that is parafollicular and follicular. These are we call as a parafollicular cell. And we are going to get remaining, which is all this will be, we are going to get follicles of the cell, that is the thyroid. So here when you see parafollicular cells and follicular cells, so whatever you are going to get the, these are the, we are going to get the parafollicular cells, and these are follicles we get, and whatever these all cells which are we call as a follicular cell. Means you have to tell thyroid is made up of two types of cells, follicular cell and parafollicular cell. And these follicular cell which lines the follicles of the gland and which secretes the T3 and T4, triiodothyronine, tetraiodothyroxine. So that this hormone T3 and T4 will help for the basal metabolic rate and plays an important role in the psychic and somatic growth. That is about related to the follicles, that is follicular cell. These are the parafollicular cell, lies between the follicular cell, and that is secrete the thyrocalcitonin, and that is important for the calcium metabolism. What it does, whatever the blood calcium is there, that is taken out and it is stored in the bones. Means whatever the calcium in the blood is taken by the thyrocalcitonin hormone, and it will store in the bones, muscle, almost all the part where it can store. And this is the opposite action of the parathormone, parathyroid secreting. Parathormone is what it does, it removes the calcium from the bones and adds to the blood. So that is the one which is the opposite action of the parathormone. Okay, here thyroid, parathyroid, they are doing the opposite calcium mechanism, hormone secretions. So first I am talking about the histology of thyroid gland. You have to tell thyroid is made up of the two types of cells histologically, follicular cell, parafollicular cell. Follicular cells which lines the follicles, parafollicular cells which are in between the follicular cell, and inside which is here you can see that is a colloid material, that is one which is you are going to get in the gland. Then these follicular cells which secretes the one hormones, that is a T3 and T4. What is T3? Triiodothyronine. T4 is tetraiodothyroxine. So we call T3 and T4. This hormone, what they will do? They will maintain the basal metabolic rate and plays an important role in the psychic and somatic growth. Then these parafollicular cells which are there, they secrete the thyrocalcitonin. What it does? it removes the calcium from the blood and stored into the bones. And this is exactly opposite action of the parathormone, which is secreted by the parathyroid. That is what it does. It removes the stored calcium from the bone and it is adds to the blood. So that is the parathormone action, and I am talking about the thyrocalcitonin. Okay, thyrocalcitonin, it will be plays an important role in the calcium metabolism. So this is all about the structure and function of the thyroid gland. Okay, all I have told in the introduction of the gland, it maintains the three function major, that is basal metabolic rate, psychic somatic growth and calcium metabolic. These are the three functions which we have come across according to the histology and histological cell that you have to remember. So this is all about the histology and functions of the thyroid. When we are going to deal about the clinical anatomy of thyroid. So most important, when this thyroid gland is increases in size, in the neck region you are going to get that is a condition that is we call it a goiter. Goiter is an enlargement of thyroid gland, and that is due to the deficiency of the iodine. Iodine is required for the synthesis of the thyroid hormone. If there is a deficiency, this will lead into an enlargement of the thyroid, and that is we are going to call it a goiter. So enlargement of thyroid gland due to the deficiency of the iodine, which is called as a goiter. Okay. Then you have the all like endocrine glands, like there is a hypersecretion and hyposecretion. If there is an excessive secretion of the hormone and less secretion of the hormone, when this thyroid is we call it a hyperthyroidism, that condition one clinically we get, that is a Graves' disease. Graves' disease, which is caused, that is due to the hyperthyroidism. Also we have the thyrotoxicosis. Thyrotoxicosis, Graves' disease, all this will be relating to the, that is a hypersecretion of the thyroid. Then what happens when there is a hyposecretion? Hyposecretion, it will cause the cretinism in children and myxedema in adults. It causes the condition, clinical condition, cretinism in children, and it is causing the myxedema in the adults. Okay? When this is enlarged and it is causing complication or other associated symptoms, we may remove surgically. So we are going to call it a surgical removal of thyroid gland. We are going to call it thyroidectomy. But we are going to preserve the, that is the, whatever the posterior border of the thyroid, because it contains the, that is we have the parathyroid gland. If parathyroid also removed, again we are causing the patient. So that we are going to preserve the gland parathyroid posterior border of the thyroid, because we are not going to remove during the thyroidectomy. Okay. Then any tumors arises from the gland, that we are going to call as a tumors of thyroid, and that is may occur. So in the applied anatomy you have to remember goiter, enlargement of thyroid gland which is due to the deficiency of the iodine, called as a goiter. Second one, you have to tell about the hyperthyroidism, Graves' disease, thyrotoxicosis. Then hypothyroidism is a cretinism and myxedema. Then I have told the tumors of the thyroid gland. That also causing the tumors arising from the thyroid. Then we do surgery for the surgical removal of the thyroid gland, that we call as a thyroidectomy. Then this you have to apply with the true capsule, false capsule. In relation to the prostate, I have told in the introduction of the thyroid. So after this, we have to do the next one, which is blood supply of the thyroid gland. Here thyroid is, you are going to see here, it is supplied by the two major arteries. Blood supply of thyroid is by the superior thyroid artery and inferior thyroid artery. And superior thyroid artery is a branch of, we are going to get the external carotid artery. We are going to get the external carotid artery. Okay? Internal carotid artery does not give any branch. External carotid artery gives the superior thyroid artery. And inferior thyroid, which is coming here, it is arises from the thyrocervical trunk. It is a branch of thyrocervical trunk. It may ask in the MCQ. Superior thyroid artery is a branch of external carotid artery. Inferior thyroid artery is a branch of thyrocervical trunk. That is where. Usually it is said that the upper 1/3, lower 2/3. Upper 1/3 is by the superior thyroid, lower 2/3 is by the inferior thyroid artery, lobes attached, that is the blood supply. Isthmus we divide upper half, lower half, superior thyroid and inferior thyroid. Usual the area of blood supply of the thyroid gland. So thyroid gland is supplied by the blood supply by the superior inferior thyroid artery. Superior thyroid artery is a branch of external carotid. Inferior thyroid artery is a branch of thyrocervical trunk. When we go to the venous drainage, there are three veins which are there. They all drains the venous drainage. We are going to get the middle, that is the thyroid veins. Middle thyroid vein, superior and inferior thyroid veins. They drains the venous drainage. So venous drainage is porture vein, inferior thyroid vein we call middle and superior thyroid vein. So blood supply, after that venous drainage of the thyroid is by the superior, middle and inferior. Majority we have the middle thyroid vein. Then also the superior and inferior thyroid veins. So that is all about the relating to the venous drainage of the that is the thyroid. Then what is the lymphatic drainage? See, upper part and lower part, if you divide this lymphatic drainage of the upper half of the thyroid, upper lobe and upper half of the isthmus, this is drains into the deep cervical group of lymph node. Deep cervical, neck region we have the cervical group of lymph node, but you have to explain deep cervical group of lymph nodes through the, that is we have the pre-laryngeal, that is we pre-tracheal and paratracheal we to get here. So that here we have the lymphatic drainage by the, we are going to get the deep cervical group of lymph nodes, and that is we have the upper half by the pre-laryngeal group of lymph node and lower half is by the pre-tracheal and paratracheal group of lymph nodes. In general, how to remember? The lymphatic drainage of thyroid is by the deep cervical group of lymph nodes, and upper half is by the, through the, we have the pre-laryngeal group of lymph node, lower half by the, through the paratracheal and pretracheal group of lymph nodes. So this is all about the blood supply, venous drainage, lymphatic drainage of the thyroid. Then what is the nerve supply? Where you can see this is we are going to get nerve. We are going to get the middle cervical ganglion. The nerve supply will be by the middle cervical ganglion, that is supplying the, that is the nerve supply to the thyroid. Okay, you can get the this recurrent laryngeal nerve relations diagram, but you are going to have the, that is thyroid is supplied by the middle cervical ganglion. So we have studied the blood supply, venous drainage, lymphatic drainage and nerve supply. Then I have told the function and structure of the thyroid and clinical anatomy of the thyroid. So relations also we have done. So this is briefly about, we have covered the relations of the lobe, even apex, base, anterior border, posterior border, medial and lateral and posterior lateral surface, all relations. Then I have told the isthmus relation, anterior surface, posterior surface, upper border, lower border. Then including lobe, apex and base, I have told the relations. Very important. Most important, you have to remember the transverse section of the neck region. This diagram for the, you have to remember for the exam. This diagram you can draw for the trachea, esophagus, carotid sheath, neck muscle, and we have the nerves. So this is one diagram which is sternocleidomastoid also. You can draw this diagram for the making the relations of trachea, esophagus and thyroid. Most important. So this diagram you have to apply for the 5 topics. So this is the one which is you have to remember. Then I have told after relation, I have told the structure and function of the thyroid gland. That is very important. 3 functions you have to remember. Hormone secreting T3, T4, triiodothyronine, tetraiodothyroxine we call. That is a thyroxine also we call T4. Then thyrocalcitonin I have told. What is function? Basal metabolic rate, psychic and somatic growth and calcium metabolism. This is all about you have to remember. So this is all about relations, structure and function. Then I have told what is the blood supply, venous drainage, lymphatic drainage. Then lastly we have also covered there is a clinical anatomy of thyroid. So most important here you have to remember clinically where you can get the diagnosis, that is a goiter. Any person came with the swelling in the neck region which moves with the swallowing. So any which patient is made to swallow, then it is moving with the structure swallowing. You have to assess the thyroid plus examine thyroid gland. Then you have to assess the thyroid hormone investigation. Then you can treat the patient. Only simple way maximum, that is the enlargement of thyroid gland, is due to the deficiency of the iodine. And how much is our thyroid in distal fillings of that of now. So how we are going to provide? So any person which is came with the enlargement in the neck, thyroid gland, goiter, just you have to first treatment is you have to give the supplement of that of the iodine. So iodine is required very minute in milligrams, that is. So that is. So we have done all this is done in the, that is the in the condition known as the iodized salt. Salt is provided in the form of iodized. So that will be all taken in. So any which is enlargement of the thyroid, which is we are going to get, that is the first you have to deal, that is a remember, is it related to the deficiency of iodine leading that is a goiter. So give the iodine supplement. Then you can diagnose or investigate the blood investigation of thyroid hormone, T3, T4 and TSH. On that you can diagnose is it a condition of hyperthyroidism or hypothyroidism. Then accordingly you can treat. But simple one first, you may also understand the difference between the goiter and tumor. So that will be very important in treating the thyroid cases. Okay. So this is all about the thyroid. What you have to remember most important is what is the measurement, what is the weight, what are the parts, what are the relations, what is the function and histology of the thyroid, and we get the clinical anatomy. And blood supply is very important for the short notes MCQs, that is superior inferior thyroid artery. So superior thyroid artery is a branch of external carotid, inferior is a thyrocervical trunk. And goiter I have told, what is the Graves disease, what is the cretinism, what is the myxedema, you have to detail study in the physiology. So that is all you have to remember. So this is briefly about the thyroid. Here we have completed the thyroid gland. Okay, write down.